If you're like millions of other Americans, you probably have neck pain. As a chiropractor and physical therapist, a large percentage of my practice is treating neck pain. And what I find so consistent across the board with all these patients that come in and see me are the explanations for their pain. So today I want to bust a top 4 myths about neck pain. Hi, I'm Dr. Aimee Oliver, practicing right here in San Antonio, Texas, where I combine chiropractic and physical therapy to help people just like you live pain-free. On this channel, I'm here to give you practical, effective solutions for your pain. Let's talk about the real causes of neck pain and some common misconceptions I hear all the time. So here's one I hear a lot. It's just muscle. No, it's not. If you've had the pain for months, years, let me tell you something, it's not just muscle. You've tried massaging it, you've used the blue knobby thing on it, you've used the massage guns. If it was just muscles, it would have gone away. Sure, muscles play a big role, but the bigger issue here is your alignment and your posture. You may even have some degeneration going on that you're not even aware of. If it was just muscle, you wouldn't still be in pain after all the gadgets and massages, right? That's why you need x-rays from a corrective chiropractor to really assess what's going on with your neck. I can't tell you how often people, especially folks who work out a lot, think that there's some magic tool that's going to release that shoulder blade pain. You know, they use a foam roller, they use a lacrosse ball, and it's always just a temporary relief they get from it. I've been there myself. For the first half of my career, I gave people only temporary relief, and I hate to admit that, but that's why I started performing corrective chiropractic. I'd adjust the spine, work on the joints, dig into muscles like the rhomboids, the upper traps, and the scalenes, and while it always helped, it was always temporary. We would think that the person was fixed, I'd discharge them from care, and then lo and behold, I'd run into them at the grocery store or someplace a few months later, ask them how they're doing, and we would find out their pain had come back. And I have to tell you, that's frustrating for me and of course for the patient. But about 10 years ago, I learned about chiropractic BioPhysics, and that's when things really started to change. See, 99% of my patients with chronic neck pain, so long-term neck pain, they had a loss of curvature in their spine, and using the chiropractic BioPhysics protocol, we work to remodel the spine, which is the only thing that has really fixed their pain for the long term. Another one I hear all the time is my neck is fine, I just carry stress in my shoulders. Well, let's unpack that. First of all, when you're feeling pain or tension in your upper traps, that's not really shoulder pain. That's pain that's actually coming from your neck. True shoulder pain happens on the sides of your shoulders, not up here in the traps, and not even back here by your shoulder blades. Now, it is true that stress can absolutely make your pain worse. It does cause a tensioning of the jaws, the upper neck, and the lower neck, but the fact that you feel stress in your shoulders like that isn't normal. There has to be an underlying neck problem for stress to even cause that kind of pain for you to perceive it. Another one I hear an awful lot is that my neck pain is in the morning because I need a new pillow. Now, believe me, this is a very popular misconception. And while I'm all for finding the right pillow or mattress, 9 times out of 10, the real problem is not your pillow. What's usually happening is that you have arthritis or degeneration in your spine. Now, overnight, those arthritic joints cause tightness and spasm, and that's why you wake up sore. It's not the pillow's fault, and buying your 10th pillow isn't gonna fix it. It won't hurt, don't get me wrong, but just because you wake up with pain doesn't mean you need a new pillow. Here's one I wish were true. That car wreck I had years ago has nothing to do with my current pain. Unfortunately, when it comes to your neck, that's just not the case. Let me paint the picture. You get rear-ended, your neck is sore for a few weeks, maybe you go to therapy, maybe you take some medications, and then the pain goes away. So of course, you think you're fine. But here's what really happens. That injury causes spasms, which cause inflammation. That leads to a loss of motion in your spine. Now, as the neck pain goes away, your neck still wasn't moving like it was supposed to or like it's used to, and so now your alignment isn't like it's supposed to be. Years go by, you feel normal, but now that you've lost that natural curve in your spine, the muscles are constantly stretched and the weight of your head is coming down on the front of your spine. Over time, this causes the disc to break down. So I hate to be the bearer of bad news, but by the time I see people in my office, it's usually because they have significant degeneration in their lower neck, usually at C5, C6, or C6, C7. And if you've had x-rays or MRIs and you were looking at those forms, you would probably find that's where your problem is. It's because these levels are lower in the spine and take most of the stress from the misalignment. Now, depending on how much damage there is, the best we can do is slow that process down, unfortunately. So if you've been in a car accident, even if you feel fine, please go see a corrective chiropractor. Do not wait for years for the pain to show up. I really hope this video shed some light on why you still might be having that neck pain even after trying everything on your own. The big takeaway here is don't put off getting treated. If your neck is misaligned, the longer you wait, the worse the degeneration gets. And you don't want to be in my office years from now with even worse pain and even worse than that, true damage. Now, if you're at the point where you've tried everything and you still have pain, reach out to our office or drop a comment below. If you're in the San Antonio area, we begin by taking x-rays to assess the precise alignment of your spine and create a treatment plan to help it. Lastly, if you got something out of this video, hit that like button and subscribe to the channel for more tips on living a pain-free life. Thanks for watching, and I'll see you in the next video. Have a great day.